Hello everybody, I hope this finds you well. I'm going to start off today by talking about where we're at in the pandemic in terms of our numbers. I'll then talk briefly about where we are with vaccination delivery and rolling out the programme further and what that means for staff as well as the general population. I'm going to talk also today about the pressures on our partners in the ambulance service briefly, and then I'm going to finish up by talking about dementia awareness and the Herbert protocol in particular. So if I start off with the numbers of new patients reported yesterday were 454. That is trending down. It still sounds like a high number, but we are now seeing that number coming down day by day, which is encouraging. What we would normally see is the inpatient numbers continue to increase for 2 weeks after that starts to decrease. So the numbers of inpatients at the moment are sitting at 138, and that number is fairly stable but still going up gradually. I'm hoping it will top out quite soon. Again, the ICU numbers normally follow on from the inpatient stays, but we have got 9 patients in ICU. That was up as high as 16 a few days ago. So again, that's still a bit up and down, and very difficult obviously to manage the elective urgent patients alongside those COVID numbers, because that's just the COVID patients that are in ICU. So quite a lot of pressure on our ICUs, particularly this week actually at Monklands, but we've been doing whatever we can to try and move staff around and support the staff at Monklands, and just big thank you to them, because I know a lot of them have done extra shifts to keep that ICU going, and in fact across all 3 ICUs people are putting in extra hours, so just a personal thank you from me to the ICU teams. Care home outbreaks 9 at the moment, which is the same number I think as last week broadly. And the vaccination programme is continuing. I think I shared with you last week that we would be going back into care homes. That has started. We went into Abercorn care home this week, and that was the first care home we went into right at the beginning of the vaccination programme. So nice that that was again the care home that we went into this week. And you may have seen some communications around the care home vaccination programme delivery. So great that our older people are getting their third vaccination, their booster. The other thing that we will be doing for staff is offering flu vaccination, and we will do that where possible alongside the COVID boosters. So front-facing staff and all those staff over 50 will be eligible for that. You will, if you're over 50 and you're not front-facing, need to think through when your second vaccination was, and it should be around 24 weeks or 6 months when you come back for your booster. So just think through your dates and when you're booking that. So there'll be more information around that on our web pages, but that's the period that there should be between your second jab and then your booster one that you'd have alongside the flu in the autumn. So we'll be opening up, in fact I think we already have opened up for front-facing staff, because they obviously were jabbed right at the beginning, so they're now booking in for their booster COVID and their flu. I said I'd say a bit about the Scottish Ambulance Service. You may have seen in the press and on the radio and the television that the Scottish Ambulance Service has been under huge pressure, and there have been a number of initiatives just this week and last week to see what we can do to support our colleagues in the ambulance service, and there are a number of things being looked at there, redeploying staff, military aid, which I think has now been agreed, etc. What I would say though is the whole system remains under pressure at the moment. The ambulance service is a symptom of the whole system pressures, and that's not just within the health service, also really importantly within our social care partners. And staffing is a key issue really for social care providers, our care homes, etc. as well. So there's pressure across the whole system, and obviously we just need to think about anything we can do at all to work together to try and alleviate that as we go into the winter. So we're having lots of conversations around that at the moment. Finally, I just wanted to talk a bit about dementia awareness. We talked last week about falls awareness, and I think we've got a whole month at the moment around dementia related issues, falls obviously being one, but dementia awareness is really important, and I know most people watching this will know somebody with dementia. The Herbert protocol is something that has been pioneered by Police Scotland. If you want to find out more about it, you can go onto the Police Scotland website and just click on the link for the Herbert protocol. But it provides everybody with a way of logging a loved one's details, so that if they do wander off, as older people with dementia are unfortunately prone to do. We know where they're likely to go, and we have a list of their details and the contact details for next of kin, so that's really important. That's worked really well. It was introduced in 2019, and over the last couple of years there have been numerous examples where it has really speeded up the police response and enabled us to recover older adults with dementia without any mishap. So if you have got somebody in your family, or you know somebody who might benefit from that, I would encourage you to use the service, because you never know when you might need it. I'll finish there. I just want to say again, I know we're under a lot of pressure at the moment in the NHS, and I do appreciate everybody's efforts, and I hope you do get a chance to get a rest over the weekend when it comes. Thank you very much.